and in this recording we will delve into the Summer 2024 Chief Examiner's report on the T-Level Health Occupational Specialisms. We'll examine how students performed, identify key themes and explore strategies to support enhanced teaching and learning. So we will explore assignment performance overview. We will begin with the assignment 2 part 2, support healthcare core, as this applies to all occupational specialism. We will then filter down into the key themes for the different OSs. We'll then summarise the key themes across all OSs and strategies to support yourself as teachers and students. And finally, we'll explore where you can continue to get support from NCFE. So let's begin with the assignment performance overview in relation to the support and healthcare core. Assignment 2, practical activities, part 1. So overall, students performed well, benefiting from placement and simulations. However, there were variations of performance quality and evidence submission. Key observations include the need for consistent equipment and SP performance, clear evidence and detailed documentation. Let's explore more scenario-specific development areas. So in this scenario, strengths included a holistic approach and effective use of pain assessment tools. Challenges were task focus and inconsistent standardized patient performances. Students excelled in PPE usage in scenario 2 and the patient communication. However, there were issues with incomplete documentation and variable handling techniques. For scenario 3, strengths included accurate measurements and responsive care. Challenges were over-reliance on equipment and incomplete documentation. So overall, strengths included holistic skills and technical accuracy. Areas for development include documentation, communication, and SP consistency. Now let's explore the support and adult nursing teams. So in assignment 1, task 1, focused on creating holistic care plans. High marks were awarded to students who detailed how patient conditions influence care strategies, even when MST errors occurred. Those who compensated with comprehensive care plans still performed well. In task 2, setting SMART goals was crucial. Students who crafted detailed patient-centered goals scored higher. Challenges arose when goals were too generic or not fully reflective of the patient's situation. In tasks 3 and 4, involving integrating case studies, students effectively summarised patient conditions and clearly articulated the involvement of health professionals did well in task 3. Task 4 required detailed evaluation of care effectiveness. Those who excelled demonstrated a deeper understanding of patient care. For assignment 2, in scenario 1, students needed to interact with patients and carers while recognising when to escalate care. High achievers balanced task completion with patient rapport, effectively identifying serious conditions that required escalation. Scenario 2 tested students' use of PPE and their communication skills. Higher marks were awarded to those who adhered to proper procedures and communicated effectively. However, incomplete documentation and neglected safety checks lowered some students' scores. Scenario 3 focused on measuring vital signs. High achievers demonstrated accuracy in their measurements and provided clear explanation to patients. However, reliance on equipment without manual checks and environmental distractions led to some inconsistencies. In scenario 4, practical measurement tasks were generally well executed. However, overlooking steps like equipment checks and patient communication reduced scores for some students. Assignment 3 emphasised reflection. Theme 1 highlighted physiological measurement skills, though some students struggled with practice development. Theme 2 saw strong understanding in skin integrity and teamwork, while Theme 3 focused on duty of care and communication barriers, with effective discussions on personal care experiences. Those who demonstrated confidence and clarity in discussing their learning and skills achieved high grades. Now let's explore supporting care of children and young people team. Task 1 focused on safeguarding risks. For assignment 1, high-scoring students recognised risks such as self-harm and effectively used safeguarding policies. However, some responses were incomplete in identifying risks or lacked clear decision-making strategies. Task 2 required addressing carers' health and social care needs. Strong responses provided comprehensive summaries and detailed decision-making strategies. However, some students missed important details, particularly about family dynamics and actionable steps. In Task 3, students were tasked with preventing injury behaviours. High-quality responses included specific techniques for stress and anxiety management. Challenges included a lack of detail and inconsistent application of safeguarding principles. Task 4 involved evaluating risk minimisation plans. Strong responses thoroughly evaluated existing plans and proposed modifications. However, some students did not delve deeper enough into the evaluation process. For assignment 2, in scenario 1, students were assessed on equipment checks. High achievers provided clear explanations and followed proper cleaning procedures. However, some students lacked detail and provided incomplete information in their checks. Scenario 2 focused on supporting parent. Strong responses made effective use of resources and handled confidentiality well. Some students, however, did not provide enough detail and dietary advice or make inappropriate reward suggestions. For scenario 3, which involved supporting a child with continence issues, successful students built good rapport and used advice sheets effectively. Others, however, made inappropriate reward suggestions or were inconsistent in their role play information. And for scenario 4, which focused on nutritional assessments, high performers engaged well with both the young person and their parent, using available resources effectively. Some students struggled with legibility and the detailed recording of discussions. For assignment 3, theme 1 covered end-of-life care. Strong responses demonstrated compassionate care and involved families effectively adhering to NICE guidelines. Some students provided vague reflections or lacked specific examples, particularly regarding multidisciplinary aspects. Theme 2 focused on clinical tasks and interventions. Successful students addressed discharge planning and infection control protocols effectively. However, some responses lacked procedural details and did not sufficiently discuss the complexities of the role of teamwork. Theme 3 covered safeguarding in alternative living arrangements. Strong responses described transitions and teamwork effectively, applying safeguarding principles. However, many students displayed a superficial understanding of signposting effectiveness and provided insufficient examples. Now let's explore the supporting mental health teams. So for assignment 1, those who use NCFE performers generally performed better. It is clear students generally demonstrated a good understanding of Adam's background, but struggled with evaluating his mental state. This gap affected the ability to summarise his needs comprehensively, which is crucial for developing an effective support plan. Adhering to these formats is crucial for structured and complete responses, yet some students did not follow this, impacting their performance. Task 2 proposed challenges, particularly due to the non-use of NCFE performers, leading to incomplete submissions. Emphasising SMART goals and addressing Adam's holistic needs are essential for creating a structured and effective recovery plan. While students recommended appropriate treatments for Adam, there was a need for these recommendations to be more precisely tailored to his specific needs. Following task instructions closely and providing thorough evaluation will enhance the quality of treatment plans. Task 4 proved to be the most difficult, with many students struggling to make insightful recommendations and summarise the next steps for Adam's recovery. This difficulty could stem from various factors, including time management issues, inadequate understanding of the task guidance, or gaps in knowledge. To improve, students should focus on critically analysing evidence, proposing meaningful improvements to the relapse prevention plan, and effectively summarising actionable next steps that align with Adam's recovery goals. In assignment 2, scenario 1, many students effectively made patients comfortable and used open-ended questions. However, there were lapses in maintaining confidentiality, hand hygiene, and thoroughly exploring patient responses. Scenario 2 focused on anger management. While most students accurately discussed strategies, there was a lack of personalised approaches and insufficient exploration of underlying causes of anger. In scenario 3, students were effective in identifying patient symptoms and discussing interventions. However, more thorough exploration of symptoms, patient goals, and safeguarding measures are needed. In scenario 4, students addressed confidentiality and offered coping strategies. However, there is a need for deeper exploration of self-harm details and more individualised support strategies. In assignment 3, assess the involvement in care plans. Strong responses provided detailed insights and showcased excellent communication skills. However, some students offered vague responses, lacking clarity in care strategies. Many students articulate professional boundaries well, using concrete examples, and demonstrated a good understanding of coping strategies. However, more detailed examples and specific discussions on coping benefits are needed. Students generally use personal learning experiences effectively, but some struggle to meaningfully integrate these experiences or correctly identify specific mental health conditions, affecting their ability to tailor interventions. Students displayed a solid understanding of national guidelines and identified interdisciplinary roles well. However, the application of guidelines were inconsistent and more detailed explanation of roles are needed. Many students articulated the benefits of collaborative work and coping strategies effectively, yet some responses were overly focused on personal achievements, missing the broader team dynamics. Assignment 3 also assessed mental health interventions, with many students demonstrating an understanding of holistic and recovery-focused approaches. However, some responses lacked depth, particularly in recovery-based care. Now let's explore the supporting midwifery team. In task 1 of assignment 1, students were asked to summarise Susanna's pregnancy, focusing on her needs, the roles of the multidisciplinary team, and the impact of gestational diabetes. Higher grade responses were detailed, covering all aspects comprehensively. However, lower grade responses often lacked depth, missing critical information about the stages of pregnancy and the role of various team members. Task 2 required students to summarise birth options, considering the impact of gestational diabetes. High-performing students discussed pain relief options in detail and effectively linked delivery methods with the professionals involved in the multidisciplinary team. Lower grade responses, however, often missed key sections and lacked a logical flow, which affected the overall coherence. In task 3, students developed a postnatal care plan, focusing on physiological measurements and breastfeeding support. High-scoring students demonstrated accuracy in interpreting postnatal charts and made appropriate care recommendations. Conversely, lower grade students showed inaccuracy in chart interpretation and a lack of integration in the care planning elements. Task 4 involved reporting on postnatal visit, the focus on mental health and breastfeeding support. Higher grade responses provided a comprehensive approach, effectively addressing mental health concerns and offering sound recommendations. Weaker responses, however, often lacked depth, focusing insufficiently on key areas and failing to adopt a holistic approach. So for assignment 2, so in scenario 1 of assignment 2, students taught baby hygiene practices. Stronger responses demonstrated thorough teaching and safety measures, while weaker ones lacked necessary equipment and detailed documentation. In scenario 2, which involved taking physiological measurements, high-scoring students performed measurements accurately and communicated effectively, and lower grade responses, however, often missed key parameters and failed to escalate abnormal results appropriately. In scenario 3, involved preparing a pregnant patient for an ultrasound scan. High-achieving students provided clear explanation, ensured privacy, and obtained consent. Lower grade responses often missed critical steps and lacked sufficient documentation. In scenario 4, supporting skin-to-skin contact, the best responses detailed the physiological and emotional benefits, while weaker ones failed to gain verbal consent or adequately cover the benefits. Now let's explore assignment 3. So let's explore theme 1, which focused on safe sleeping and parental skills. In the section of safe parameters for sleeping, high-quality responses provided detailed safe sleeping guidelines and demonstrated an understanding of how external agencies support these practices. However, some responses missed crucial connections to risk reduction and lacked detail on agency support. In the area of parental skills and MDT escalation, high-scoring answers effectively listed baby safety skills and described the process for escalation concerns to the multidisciplinary team. These responses were thorough and demonstrated a good grasp of the professionals involved. Lower grade responses, in contrast, either missed important skills or failed to clarify articulate escalation procedures. Moving on to skin-to-skin contact. Higher grade responses in this section on suitable environments covered the environmental needs and comprehensively included all relevant caregivers, not just the mother. Lower grade responses, however, focused mainly on the activity itself rather than the surrounding environment. Regarding the benefit of skin-to-skin contact, high-scoring students provided a detailed explanation of both physiological and emotional benefits, linking these to bonding and feeding. They addressed benefits for both breastfed and non-breastfed infants. In contrast, lower-grade responses lacked depth in discussing hormonal responses and broader benefits. Next, we'll look at theme 2, mental health. In identifying signs of mental health, ill health and reporting, high-scoring students clearly describe signs and reporting procedures, supported by reflective accounts. Lower-grade responses struggled with detailing these procedures. When discussing the impact of mental health on pregnancy, high-achieving students provided a detailed analysis of how mental health affects pregnancy outcomes, often supported by personal experiences. Some responses were brief and repetitive, lacking necessary depth and detail. With theme 2, the section on physiological measurements covering measuring and reporting newborn measurements, higher grade responses accurately detailed measurement procedure and how to report deviations from normal ranges. Lower grade answers often missed normal ranges or were incomplete in reporting. In discussing factors impacting measurements, higher achieving responses address factors affecting both mothers and babies across different stages, showing a strong understanding of the theme. Lower grade responses, however, often focus primarily on postnatal factors and miss considerations relevant to pregnancy. Moving to theme 3, which focused on care planning and MSW roles. In this section on the MSW role in postnatal care planning, higher grade responses effectively linked MSW roles to care planning. Lower grade responses were more descriptive and lacked focus on the planning aspect. When discussing the importance of accurate care plans, high-scoring students provided detailed explanations supported by relevant legislation and practical examples. Lower-grade responses struggled to contextualise the importance of accuracy with real-world scenarios. Finally, in this section of MSW responsibilities in clinical and therapeutic tasks, higher grade responses offered detailed and clear descriptions of the roles. Lower grade answers showed repetition and lacked a clear distinction between clinical and therapeutic tasks. For the topic of meeting policies for confidentiality, high-scoring students demonstrate strong knowledge of confidentiality policies and their application. Low-grade responses, however, lack detailed analysis and struggle to apply these policies to their personal practice. Now let's explore supporting therapy teams. So let's begin with physiotherapy assessment plans. So students excelled in summarising patient histories and understanding the impact of medical conditions on daily life. They effectively extracted relevant information and demonstrated a solid grasp of person-centred care. High-performing students also developed care plans that connected patient needs with recommended interventions. However, many struggled to provide clear rationales for the recommendation and showed variability in the quality of their care plans. To improve, we should emphasise the importance of rationales in clinical decisions and offer structured guidance and linking theoretical knowledge to practical patient case scenarios. In patient care plans and therapy recommendations, students demonstrated the ability to create detailed therapy plans and understood therapeutic goals well. They effectively integrated relevant guidelines into their plans. Challenges included variability in the clarity and specificity of therapy treatment plans and inconsistent integration of clinical guidelines. To address these issues, you should focus on enhancing students' ability to link therapeutic choices to patient needs and improving guidance on how to integrate clinical guidelines into patient care plans. In clinical evaluation feedback analysis, students showed strong analytical skills by identifying strengths and challenges from clinic feedback and offering practical recommendations. However, some struggled to provide specific, actionable recommendations and inconsistently identify training needs. To improve, we need to emphasise translating feedback into specific improvement strategies and offer clearer guidance on identifying and articulating training needs based on feedback. For assignment 2, Scenario 1, students excelled in establishing rapport, using patient dietary records and providing relevant dietary advice. They also showed awareness of the MDT and customised advice based on patient preference. Areas for development included explicitly discussing confidentiality and GDPR limitations, developing SMART goals and monitoring processes, ensuring accuracy in care plans, and ending the meeting positively to ensure the overall patient experience. For scenario 2, students were effective in building rapport, handling confidentiality, and completing assessment forms accurately. They also showed a supportive approach by offering additional contact. Improvements are needed in exploring patient preferences in a warmer manner and ensuring thorough documentation to support continuity of care. In scenario 3, students performed well in conducting safety checks, using PPE correctly and reporting faulty equipment. However, some missed completing all checks or failed to ensure all details on forms were accurate. Attention to detail in these areas, such as checking all equipment parts and printing names on forms, is essential for maintaining accountability. In the fourth scenario, students demonstrated empathy, a good understanding of patient situations, and effective identification of patient-led goals. They also addressed mental health needs appropriately. To improve, students should focus on effectively using communication aids, ensuring recommendations align with patient goals, and providing communication tools to take home. Additionally, showing the patient out can enhance the thoroughness of the interaction. Now let's explore assignment 3. Students showed insightful reflections on the roles of AHPs and effectively described their responsibility. There was a clear emphasis on holistic patient care and the collaborative nature of AHPs. Areas for development included better application of theoretical knowledge in practical settings and exploring how interdisciplinary collaboration impacts patient outcomes more deeply. Students demonstrated a thorough understanding of safeguarding practices, including risk assessments and adherence to policies. They also highlighted the importance of continuous training. Improvements can be made by providing specific samples of safeguarding protocols and practice and connecting these practices with broader ethical considerations. Students effectively acknowledged the importance of respecting cultural and religious beliefs and used strategies for integrating these considerations into care plans. Improvements included providing detailed examples of how to navigate cultural differences and enhancing training on personalised care planning and the rationale behind adaptations. Students recognised the essential role of therapy support workers in assisting with exercises, monitoring vital signs, and providing emotional support. They also acknowledged the collaborative role within multidisciplinary teams. Further development is needed in articulating specific contributions and linking theoretical knowledge to practical scenarios. And finally, students effectively use feedback to set specific goals and improve their clinical skills. They demonstrated a proactive approach to professional development. Areas for development included connecting feedback to specific goals and articulating long-term aspirations. More emphasis on how feedback translates into actionable plans would be beneficial. Students understood the importance of adhering to equipment management and stock control protocols and recognised the value of ongoing learning. Improvement can be made by providing specific examples of equipment management challenges and articulating clear milestones and timelines for learning goals related to equipment management. So now we've explored each of the occupational specialisms and their individuality. Now let's explore the key themes that went across all OSCs. So in the supported healthcare core, students generally demonstrated strong communication skills and competence in basic healthcare tasks, such as taking vital signs and performing routine assessments. However, some students missed critical detail in scenarios and showed variability in documentation completions and accuracy. To address these issues, we need to focus on improving attention to detail and consistency in written documentation. In the supporting adult nursing, students excelled in direct patient care, demonstrating empathy and effective communication. Their clinical skills, including wound care and medication administration, were generally high. However, some struggled with critical thinking and decision making, particularly in complex scenarios. There was also instances of non-adherence to clinical protocols and missed safety checks, enhancing critical thinking and adherence. In supporting care of children and young people, students showed strong skills in engaging with young patients and understanding their development needs. However, challenges included ineffective communication with families or carers and inconsistent documentation of child-specific needs, leading to gaps in care continuity. To improve, we should focus on enhancing family communication and ensuring thorough documentation of developmental considerations. Students in the support and mental health teams excelled in providing emotional support and demonstrating empathy towards patients with mental health conditions. They also showed a strong understanding of mental health issues. However, there were struggles with applying theoretical knowledge to practical scenarios and managing complex or crisis situations. Improving the application of theory and handling complex situations will be essential. In the midwifery teams, students demonstrated solid knowledge of maternal and neonatal care and effective use of supportive care techniques. However, there were challenges in coordinating care within multidisciplinary teams and handling complication. Enhanced training and coordination in emergency responses will be beneficial. Students in the support and therapy team showed proficiency in applying therapeutic techniques and collaborating with patients to support therapy goals. Challenges included accurately assessing and monitoring patient progress and adapting to unexpected changes in patient conditions or therapy needs. Improvement assessment skills and adaptability will enhance overall performance. Across all specialisms, students demonstrated adequate preparation and strong communication skills. However, common challenges included inconsistent documentation, varied adherence to protocol and procedures, and struggles with critical thinking and problem solving. Addressing these cross-specialism issues will be key to improving overall performance. So let's explore some key strategies to support delivery for you and outcomes for your students in these key themes. To enhance teaching practices, we can incorporate interactive and experiential learning methods such as high-fidelity simulations and role-playing scenarios. These approaches help students bridge theoretical knowledge with practical application. Utilising technology, including e-learning and VER tools, further enriches the learning experience. Promoting active learning through group discussions and peer teaching encourages deeper understanding, while reflective practice through journals and regular feedback fosters self-awareness and continuous improvement. To enhance learning experiences, it's crucial to create a supportive environment where students feel comfortable expressing concerns and asking questions. Strengthening clinical exposure through extended placements and shadowing professionals provides a valuable real-world experience. Utilising diverse teaching methods such as blending traditional and online instruction and incorporating guest speakers caters to various learning styles. Promoting lifelong learning through CPD activities and career planning helps students stay updated and set clear career goals. Improving assessment practices involves implementing varied methods such as formative assessment, practical evaluations, and project-based tasks to gauge comprehensive competencies. Ensuring clear assessment criteria through detailed rubrics and comprehensive briefs help maintain transparency and effective preparation. Encouraging self-assessment and peer assessment provides valuable feedback and learning opportunities. Finally, using data-driven insights to analyse trends and refine teaching practices ensures that assessments are continually improved. To improve evidence quality, develop standardised protocols for evidence collection, including video recordings and regular quality checks to ensure accuracy. Provide ongoing training for assessors and conduct calibration sessions to align understanding and application of assessment criteria. Robust documentation practices, including detailed records and justification for marks, support transparency and accountability. So where can you continue to get support? Please visit our T-Level Health Training and Support and CPD playlist to review a backlog of our catalogue of CPD and recordings. We also have our dedicated T-Level Provider Hub, and you have curriculum consultations across your first 2 years of delivery, focusing on teaching and learning. And finally, you have your very own T-level support, which is your customer service for any queries that you may have. Please take a few minutes to complete this feedback form. Your insights are very valuable. Thank you for watching.